Every one of you, let me know how are you all. We've just completed a motivational session dealing with setbacks. How many of you attended it? Let me know. Let me just check if I'm audible and visible clearly. Yeah. Okay, so is my voice clear to everyone? Am I clearly visible to everyone? Okay. So, hi, good evening, welcome everyone. I'm Dr. Shivangi Shukla. I'm your educator for biochemistry here on Unacademy. I teach on two platforms, that is Unacademy Future Doctors here, which is the YouTube channel of Unacademy for MBBS Prof 1 and Prof 2 students. And also I teach on the Unacademy app. So you can attend either of my classes or both of my classes. You can check them out on both the classes on both the platforms. Okay. So today I have a special class for you, that is an image based session. Okay, it is image of the day, and I'll be showing an image and I'll put up a question for that. I'll give you 5 minutes to answer the question. You have to answer in the chat section. Okay, and after you have answered, I'll discuss. Okay, we'll have a quick discussion over it. Okay, so this is a very interesting session which you can use to while you're taking a break from your theory classes, and also you can use this session to revise. Okay, so yeah, about the NEET PG subscription on the Unacademy app, I'll just quickly brief all of you about that. Those of you who already know it, well and good. For those who don't, I'll brief you about that. There are two types of subscriptions for NEET PG available on the Unacademy app. One is the iconic subscription and the other is the plus subscription. Now, both of these subscriptions will give you access to resources and video lectures from top educators across the country in the field of medicine. Not just video lectures, but also quizzes, exams, combats, and a lot of tests, and regularly updated exhaustive question banks, PDF notes of different teachers, okay, of these educators. Also, you have the liberty to access the recorded form of these classes at any time of your choice. Okay, and the USP of both of these subscriptions, Plus as well as Iconic, is that you can access these while on the go on any device of your choice, be it your laptop, your phone, your tablet, or even your PC while sitting at home. So even in the comfort of your home, you are enjoying a class and during the class you will have a simulated physical classroom kind of environment, because you can ask doubts, you can raise a hand, ask any doubt that you have. So it will be just like a physical classroom environment, but you will be comfortably sitting, and you won't miss the class also, because everywhere you're carrying your phone, so you can attend the session using your earphones or headphones or whatever. Okay, so it is a very ergonomically designed course. Okay, now, yeah, this NEET PG 2022 revision batch that has come up, this is for 2 months, and it is specially designed for students that are taking the NEET PG entrance examination this year in May 2022. So, a rapid revision of all the 19 subjects using tests. So, I would advise you guys to check this out, okay? And while taking the subscription, do not forget to put in the educator code DRSHUKLA. What is the educator code? It is Dr. Shukla. DRSHUKLA. Dr. Shukla. Now this code is going to fetch you an additional 10% discount. Okay. So do not forget to put in this code Dr. Shukla. DRSHUKLA for 10% discount. Okay. Now, this is the question. As you guys can see, this is the pedigree chart, pedigree analysis. Okay. Now, across different generations, okay, 3 generations and 2 families, okay, and they are linked through marriage. Okay. Now you have to tell me what is the kind of inheritance that is depicted in this pedigree chart. Okay, what is the type of inheritance that is depicted? What is the question? The question is, what is the mode of inheritance depicted in the pedigree chart? Okay, this is the pedigree chart. Can you see there are two families here? This is one family. Now this has one family comprising of three generations, first, second and third generation. And then this family, one of the daughters from this family, from the second generation, got married to the son in this family in the second generation, and therefore the two pedigrees got linked. Okay, now both of these show some kind of an inheritance, which you have to tell me in the chat section. What is the mode of inheritance that is depicted in this pedigree analysis? Okay, all right. So your time starts now. 5 full minutes for you to answer. Come on, guys, take your time and answer in the chat section. Come on. Come on, do answer. Come on, I'm waiting for the answers. Analyze this. Everyone should be clear of the symbols used in the pedigree chart. Okay, everyone should be very thorough with the symbols. Very, very important. Okay, I'll discuss them with you if you please, if you wish to. But you should be totally aware, because it is the basic. It is a very basic. And it is very important for you guys to know how to draw pedigree charts. Okay, very, very important. This is the basic. What is the mode of inheritance depicted in this pedigree chart? Come on, do let me know in the chat section, everyone. Come on, guys, time is running up. Few minutes are left for you to answer. 2 minutes have already elapsed. 3 minutes left now. Now this, every one of you would be aware that this depicts the generation number. This is the first generation, this is the second generation, and this one is the third generation, isn't it? This is what? This is the female, this one is male. Now if it is shaded, then that is the affected individual, the individual that is expressing the trait. Okay, now this depicts the progeny, right? This line depicts the progeny. If it is a twin, then it will be depicted like this. Okay, or like this. From just one birth. Okay, this is the number of births. Okay, then if it is an adopted individual, it will be depicted in square brackets. Okay, if it is a deceased individual, it will be depicted like this. Okay, so these are the symbols. Okay, if there has been a miscarriage, it will be shown by a triangle. Okay, I think this will be it. Consanguineous marriage is depicted by 2 dashes like this. Will be it. These are the symbols that you should be aware of. Okay, now using these symbols, now come on, tell me. Come on guys, do let me know. Last few minutes left for you to answer. Come on, tell me. Everyone, do let me know what is the mode of inheritance depicted by this pedigree chart. Come on. It is an easy question. You just have to apply your brains here. It is an easy question. Okay, so last 1 minute left and then I'll tell you the answer, okay? Last 1 minute. Try and decipher and then I'll tell you a few characteristics using which you will be able to always decipher this form of this mode of inheritance. Okay, so always, so please try and focus on this here. Alright guys, so last few seconds left. Now I'll tell you the answer. 10 seconds left. You guys can venture a guess, otherwise I'll tell you the answer, okay? Okay, so the correct answer here is what? What is the mode of inheritance? The correct answer is, it is autosomal recessive. What is it? It is autosomal recessive. Now, how is it? I'll just give you a few pointers and then we'll discuss the characteristics, okay? Now, can you see there is no sex predilection here? males and females are affected in any uh, pattern. Okay, there is no sex predilection here. So what it shows is it is not sex linked, it is autosomal. Now, if it had been dominant, then even if this uh, male was affected, he would have affected all the siblings. Okay, because it is autosomal, not sex linked. So let us write the genotypes here. Okay, it will be easier for you if I write the genotypes. Now this one is affected, so it will be, let us name the gene as AA, and this one is, sorry, this one is affected, right? This one is affected and it is autosomal recessive. So we will name it as recessive, means recessive will be, it will be this. This one is not affected. Okay, if this one is not affected, then it can either be this or this. How will you know? Once we look at the second generation. Now, it can either be a carrier or it can be a healthy individual. Now, this one, this particular child is not affected, isn't it? So it can either be this or this. Similarly with this one. And similarly with this one. No, sorry, they cannot be this capital A. No, they cannot be this one. Why? Because they are getting one gene from here, right? They're getting one allele from here and one allele from here. So if they are getting this and this, it will be capital and small a. If they're getting this and this, it will be capital and small a again. But if they're getting this one along with this one, then they will be affected. Okay, understood? So I'll just write it. Just give me a second, okay? So they can either, so they can be, what will be their genotype? Their genotype will be AA, AA, because neither of these is affected. Okay, now this one is affected, isn't it? So this is getting, she's getting married to this son. This is affected. Now again, this one is also affected. It will be like this. What will be this one? Since it is not affected, this one will be A and A, like this. Okay, got it. Now for this, what you'll do, now this one is affected, it will be this and this. This is not affected, it can either be AA or A and A. Now, what are these individuals? They are, see, now how will you tell what is this? By looking at the children. Now this person is affected, this child is affected. That means he will be a homozygous state. That means this father is heterozygous, because then only will he be able to produce a small a gamete, isn't it? So this we know for sure, because here it is not explained, here it is not clear whether the whether this parent is A or A. So we'll have to look at other children. But for this one, it is now clear that it is a carrier. Okay. Looking at the children. What is this one? This one is A and A. This one is again, this one will be AA. This one will be AA affected. This is also affected AA. And this one is A and A. Okay. Got it? Now both of them will produce this. They are getting this gamete and this gamete will then meet to produce this AA. Okay, and they can either be AA or AA. They can be either capital A small a or capital A capital A. Understood this? And since they both of them are affected, so all the gametes are affected, so all their children will be affected. Now look at the genotype. For 1 minute, look at the genotype and then we'll discuss the characteristics. Okay? This is the genotype. Look at it and draw this genotype. For whenever you find the pedigree, you can draw the genotype. Okay, then it will be very easy for you to decipher. Always draw the genotype. Okay, now understood? Got it? You can draw this. I am giving you 1 minute to draw this in your notebooks and then we will discuss the characteristics. Okay, quickly draw this in your notebook. Quickly, along with draw this pedigree along with the genotype that I have mentioned. And then I'm going to discuss a few important characteristics about autosomal recessive inheritance. Okay. Understood? Drawn or not? Drawn? Shall I proceed? Okay, so I'll proceed now. What are the characteristics? Males and females are affected equally in autosomal disease, whether it is recessive or dominant. They are affected equally. Similarly, we can see here that there is no sex predilection here. Whether it is male or female, it does not matter. It only matters that the person is a human. Okay, so there is no discrimination here. All right. So the first point in autosomal diseases, autosomal recessive and dominant both, is that males and females are affected in equal frequency. Okay. Next, homozygosity is necessary for the expression of the trait. Very, very important. Homozygosity is necessary for the expression of the trait. Extremely important. Now, can you see this? Wherever the trait has been expressed, we have seen that there is a homozygous condition, recessive. Now, this is the recessive allele, and this one is the dominant allele for this trait. So, wherever it is expressed, we have seen that it is homozygous. Homozygous means both the alleles are of the same type. Both the alleles are of the same type. It is not that one is dominant, one is recessive. Both are either dominant or both are either recessive. Homozygous condition. Okay. Both the alleles. Now, for every trait, for every characteristic, there is a gene. But the gene, one gene is coming from the male, from the father, and one gene is coming from the female, that is from the mother. So, both of these genes are called alleles. Okay, so one allele is from the father, one allele is from the mother. Okay, now depending upon upon whether the gene that has been passed down, whether the allele that has been passed down is dominant or recessive, that means the trait that is expressed by the allele is dominant in the population or recessive in the population. Okay, depending upon that, the zygosity is mentioned. That is, if both the genes are recessive, or if both the alleles carry trait that is recessive, or if both the alleles carry a trait that is dominant, then the condition is homozygous. Homozygous means it is homogeneous, that is, it is same. Hetero means different. Heterozygous means one is dominant and one is recessive. So, for recessive conditions to be expressed, whether it is X-linked or it is dominant, for recessive conditions to be expressed, both the alleles should be recessive. That is homozygous recessive. If either of the allele is dominant, then that dominant one will overpower the recessive and the person will express the dominant trait and not the recessive trait. Okay, understood? Now here, the disease is present on the recessive allele. The dominant allele is normal. What is the recessive allele? It is the diseased allele. So wherever the recessive condition is present in homozygous condition, that is both the alleles are recessive, there only will the disease manifest. If at all it is capital A and small a heterozygous condition, there also this normal dominant allele is going to overpower the recessive diseased allele. Understood this? Got it? Why? Because this is the why is this one normal? Why is the dominant allele normal here? Because the disease is carried through autosomal recessive inheritance. Now, suppose the disease was carried through autosomal dominant inheritance, then what would happen? Like ataxia, telangiectasia, there are a lot of diseases that are carried through autosomal dominant inheritance. then what would happen is, then this dominant allele will be diseased and the recessive allele will be normal. Okay, so dominant conditions can be expressed in both heterozygous and homozygous state because it is dominant, so it needs just one allele to express itself. But recessive conditions need both the allele to express themselves. Okay, so homozygosity is necessary for the expression of a recessive trait. If both the parents express the trait, then all their children will express the trait. Can you see? Both the parents here are expressing the trait, so all the children will express the trait. Why is it so? Because, see, suppose both the parents are expressing the trait. So what is the genotype? It is AA and AA. What will be the gametes? They will be A, and A. All of these are diseased. All the 4 alleles are diseased. So if you make the offspring, it will be AA. Again, it is diseased. It will be A. This one is also diseased. A and A, again homozygous, diseased. A and A, again homozygous, diseased. So if both the parents are affected, then since this is a homozygous condition, then all the alleles will be the same and all the alleles will be diseased. So of course the alleles combining or fusing together to form the zygote will themselves produce diseased zygotes. Understanding this or not? Next, if the offspring has the trait but the parents don't, then they are heterozygous or carriers. How? The offspring has the trait but the parents don't. So they are what? They are carriers. Got it? This is how it is showing. The offspring has the trait but the parents don't. So you've seen that they are carriers. How? Because the offspring has the trait, that means it is in a homozygous condition. That means the parents will have at least one allele that is diseased. Okay, but the parents are not expressing, so that means they are in the heterozygous condition. That means one normal dominant allele is also present, that is overpowering the diseased recessive allele. Understanding this, very, very important. It is extremely important, okay, these points. Next, if only one parent expresses the trait, then the offspring without the trait is heterozygous. Again, if only one parent expresses the trait, then the offspring without the trait is heterozygous. See, heterozygous, this one. Heterozygous, this one. Can you see this? Okay, here also. If only one parent is expressing the trait, then the offspring without the trait is heterozygous. Of course, he will be. Why? Because this parent is expressing the trait. That means both the gametes that this parent is going to produce will be affected. So, if the other parent is not expressing, then the other parent can either have normal gametes or one normal, one abnormal gamete. Okay. So, if both the abnormal gametes fuse, then the offspring will express the trait. But if the offspring is not expressing, that means one normal allele and one diseased allele have come together. So the offspring will definitely be heterozygous. Understood this? So these are the main points. It can skip generations. Why? How can it skip generations? Can you see here in this generation it is not present. In the whole of this generation it is not present. Why? Because if you see the mode of inheritance here, AA, AA. If you see this, now they will produce gametes like these. Now what are the chances, how will they fuse? Now they will produce one offspring is this, the other offspring is this. Now one offspring is this one, the other offspring is this one. So here there are 50% chances of the children getting affected. Now consider another scenario. These are the gametes. Now what will be the, how will the children's genotype be? AA, AA, AA. Okay. Now here 0% chances of the children being affected. Isn't it here? 0. So this whole generation is skipped. If a normal parent is, if one parent is totally normal and one parent is diseased, then the next generation is totally skipped. If one parent is a carrier and the other parent is normal, then the next generation has 50. If one parent is a carrier and the other parent is affected, then the next generation has a 50% chance of being affected. Can you see how it can skip generations here? 0% chance. All are carriers. None of them is a diseased person. Understood it? Are you guys following? This is a very, very important analysis of autosomal recessive diseases. An example is sickle cell anemia. Isn't it? It is an example of autosomal recessive diseases. Another very, very important characteristic is autosomal recessive diseases are aggravated or precipitated, not aggravated, they are precipitated autosomal recessive diseases because most of the people are carriers. So they are precipitated through consanguinity. Now consider the first pedigree here, this one. Now can you see consanguinity means marrying with blood relatives, okay? Now if this person, sorry, yeah, now if you see, if this person and this person who seem to be normal but they are carriers, if they marry, okay, through consanguinity, if these marry, then what are they going to be? What are the products? What are the offsprings? AA, one of them will be AA, one of them will be A and A, the other one will be A and A, and this one will be A and A. So perceptively normal looking parents are going to produce one diseased offspring. So this autosomal recessive trait, which was not seen in the parents, is now seen in the child. And why? How is it precipitated? Through consanguinity. So consanguinity tends to increase the chances of autosomal recessive diseases being expressed. Okay, so I think this will be it for today for this session. If you guys have any doubt, then you can ask me. Otherwise, please go back and draw as many pedigree charts as you can for different diseases, different types of inheritance. Yesterday we did, day before yesterday we did maternal or mitochondrial inheritance. Today we did autosomal recessive inheritance. Then tomorrow we'll discuss another type of inheritance. I'm not going to tell you in advance, otherwise there'll be no use of the question being put up. Okay, so we'll discuss another type of inheritance and its characteristics and an example tomorrow. Okay, so please be thorough with the pedigree analysis. It is very, very important. And you as a doctor, as a clinician, should be expected to have this on your fingertips. Okay, you should be totally thorough with it. It is very easy, very interesting. So you guys should practice it as much as you can. Different MCQs. Also for PG entrance examination also, you should be very quick with this. Okay. So any kind of analysis, whether retrograde or anterograde, whether they ask you, whether they give you the pedigree and tell you how and ask you what this is, or if they give you a condition and a type of inheritance and then they ask you which of the following is the pedigree depicting it, or if they give you a particular disease and then ask you to match it with the pedigree, or if they give you a particular disease and then ask you to match it with the type of inheritance. So there can be different ways in which they can quiz you. So you should be very thorough with this. Okay, there's no scope for any confusion here. Alright, so if there's any doubt, you can ask me. I'm waiting for your doubts. Otherwise, we can conclude the session. We'll meet again at 10 p.m. tonight with the clinical applications session that we were discussing related to translation and its fidelity. Okay, So we'll complete that session at 10 p.m. tonight. Okay guys, then do subscribe to this channel if you haven't. Every day I'll be taking a few YouTube sessions on this channel, Unacademy Future Doctors, and special classes on the Unacademy app. So do follow me there on Unacademy, as well as do subscribe to this channel, Unacademy Future Doctors, for latest updates, timely updates, and notifications for my classes. Okay, alright then, see you guys, bye bye, take care, all the best, see you at 10 p.m. tonight.